Good evening, and thank you for joining us this evening on this very special discussion about Unite's recently published paper, Hungry Bellies Are Not Equal to Full Bellies. The reason why Unite published this paper is because we're concerned that the future cost of the COVID pandemic and other costs that governments are facing, this and future governments, should not be passed onto the shoulders of those who can least bear them, as they have been in the past. There has been some commentary in recent times suggesting that Irish inequality is falling. That has not been the experience of Unite Trade Union. It's not the experience of trade unions generally, and it most certainly is not the experience of those experts, those volunteers, those charities, those NGOs, those heroes working in the field day in and day out, helping our most vulnerable citizens. So in publishing this paper, not only have we done a detailed analysis of the research data, and that's for another discussion, that's for another night. But what we've done is we've spoken to 6 charities, 6 NGOs, 6 groups of volunteers who are helping our most vulnerable every day. They are Inner City Helping Homeless in Dublin, the Traveller Visibility Group in East Cork, Penny Dinners Cork, the Muslim Sisters of Éire, Grogan's Basket Brigade, who provide emergency food relief and other relief around Christmas time, and Spark, the Single Parents Alliance. And tonight, I'm absolutely thrilled that you're going to be hearing from representatives of 4 of those groups. We have Louise Bayliss. We have Louise Bayliss from Spark. We have Grogan from the Basket Brigade. We have Brian McLoughlin from Inner City Helping Homeless. And we've Breda O'Donoghue from the Traveller Visibility Group. I'm also really pleased that we're joined tonight by Dr. Kathleen Lynch. Kathleen is a sociologist. She's an activist. And she's the Professor Emeritus of Equality Studies at UCD. Kathleen began her career working with underprivileged people, underprivileged women in particular, in Dublin's North Inner City. And she's been a strong advocate for equalities her whole life. The rest of the evening, because you didn't come here to listen to me, is going to be hosted by Vincent Browne. Vincent needs little introduction. Vincent is a journalist and broadcaster with a great career behind him, and we believe a great career still in front of him. Vincent is going to be joining you this evening. He's going to be talking to everybody, drawing out the experiences people are facing on the ground. So without further ado from me, thank you very much for joining. Please share. There will also be Irish Sign Language interpretation for those in the deaf and hard of hearing community. Please share what you're watching tonight and enjoy the evening. Thank you very much, and thank you to all our guests.
And then is Kathleen Lynch with us?
Kathleen is with us, Vincent.
I don't see, she's not on the menu I'm looking at, but anyway, all right. Kathleen, hello, Kathleen.
Hello, how are you, Vincent? I'm here.
Oh, yeah, I can see you now. Okay.
I haven't changed that much since you saw me last.
Kathleen, let's talk a bit about the scale of inequality in our society, because I don't think that it's much addressed at all. And certainly the parameters of it are not appreciated by the public.
Well, I suppose when I was asked to do this, I thought to myself, one of the things that has struck me in recent times is how silent public debate has been about the depth of inequality and its persistence. And I suppose that, I think, is the important thing to remember. Inequality hasn't gone away. It's as bad now as it was before the pandemic, and indeed it's worse. And I can talk about that if you wish. But I suppose what I wanted to talk about is something that people often don't talk about. Income inequality is high. And as we know, what we call market income, as in other words, the salaries and incomes people have before tax are the highest, among the highest in Europe, in Ireland. And then social welfare and other transfers helps reduce that. But what is not reduced and what is not discussed is wealth inequality. And that is very significant. And I think that that is important to remember. The CSO and the Revenue Commissioners have a very good report on household finance and consumption services in 2018. And that shows, for example, the richest 10% in Ireland own 82% of all land. You just think about that. That's 82% of all land. Land means land under houses. Land means land for development. Land means farmland is concentrated in fewer and fewer hands. On top of that, then, something we don't discuss is inheritance. Because most inequality is inherited, actually, and Thomas Piketty spoke about that in his book on inequality. And just to give you a simple fact from the revenue commissioners, 67% of the richest 10%, their children, 67% of them, get very significant transfers of capital, including shares, property, and money. The poorest 10%, the least well off, less than 1 in 10 receive anything. And if they do, it is a very small amount of money. And to me, that's an enormous issue, because if you don't, inherited wealth is not spoken about, and it's not taxed in the way, for example, that earned income is taxed. So I think those are very good indicators in terms of even something like gross household wealth. We don't think about that. What do households own? What do they have? Again, the gross household wealth in Ireland, and again, coming from the CSO, and it's online, anyone can read it, the Household Finance and Consumption Survey 2018, the bottom 10%, their gross wealth is on average 35,000 euro. 35,000, that's not a lot of money. The top 10%, now this does include housing, ownership of houses, so it's inflated by that, of course, in Dublin especially, but it's 1.932 million. Because, of course, if you're in the top 10%, on average, you own a house, it's very valuable. But even if you take a house that's worth 900,000, it means the top 10% have another million on top of that. So I'm only saying those inequalities are phenomenal because they transfer in terms of security, whether you have, whether you can borrow, what kind of place you can live in, whether you can help your children, what you can do. Even if you can't, people say, oh, I own my own house and I have no money. Yeah, but you always have something. You have land, or you have a house, you have wealth, you have shares, you have whatever you have, paintings or jewellery, whatever, you can always use that. So I just wanted to emphasise that, because Ireland does do very well in terms of taxing earned income, but indirect taxes is also an issue that isn't discussed very much. But I don't want to take up too much time, Vincent. But I think that's, again, take 23% as the VAT rate. 23% is on a packet of cigarettes. We know that poorer people smoke more than rich people. We know that. And they have 23% VAT. It's on a lot of other things. Take even the television license, 160 euro. That's nearly the equivalent of 1 week out of 52 of your social welfare. And these are all indirect taxes. You have tax on coal, on your ESB, on gas, on electricity, on petrol, if you use it. Even if I often think of this, people who have a dog or a cat who need to go to the vet and who are on low income, it's prohibitively expensive, although that may be the only companion they have in their lives. And on top of that, they have 13.5% VAT. So I just wanted to highlight those three things: the VAT rates, which are very inequitable, and indirect taxes are, and the wealth inequalities on top of other. Of course, there are significant income inequalities.
Kathleen, you've said the situation's got worse. In what way?
Well, I think what's happened is there's a reconcentration of wealth in the top 1%, particularly. If you go back to even what I said about land, if you went back 30 or 40 years ago, you wouldn't have 82% of land being owned by the top 1%. You wouldn't. It was not the case. So there is a reconcentration because I suppose the extremely rich, if you like, are not examined, and they also they're corporatively so powerful that they can move outside the state, they can be tax exiles, and they can pay for people who are professionals do the work for them and get paid handsomely for them. So they're also part of the substrata, if you like, that keep the very rich in their place because they're paid to do so. But by what I mean as well, I suppose if you take something like the childcare is prohibitively expensive in Ireland. Housing, I mean, for heaven's sake, you need only walk around any of the big cities to see that housing inequality is growing. Fewer people in Ireland now own their own homes than they did even in 2010 or 12 or 13. And that number is declining because people can't afford to buy a house. And then the HAP payment that people get if they're on housing payment, the HAP payment doesn't cover rent. So we have a huge inflation in what is absolutely essential to living, which is the cost of housing. The cost of housing is prohibitive, and that goes back, of course, to how land is managed and controlled and everything else in Ireland.
The measure of Gini coefficient, which was regarded as the most reliable way of determining whether the scale of inequality in our society, on that basis, the situation seems to have improved a bit in the last number of years. Do you agree?
Well, yeah, I think you're referring to the paper that's quoted in this report. So I looked up the paper today. It's this Thweeson and Brian Nolan and a number of other people were involved in it. And I think the paper has been misquoted. But first of all, in fact, I have the table here online in front of me. The data that's presented in that for Ireland, where they say the Gini coefficient has actually basically reduced in terms of inequality, was taken between 1987 and 2007. The other countries which are in that in the paper that was written, most of the data refers to a later period, maybe 2012 and 2013. So comparing 1987 with 2007 is completely irrelevant for 2021. It has nothing to do with 2021. Because in 1987, I'm old enough to remember, the country was on its knees. So at that time, between that and the top of the end of the Celtic Tiger, there was a slight reduction. The other problem with the Gini coefficient is it does not measure. And they say that in that paper, and the task say it in their papers, and so do many other people, that it's not a good measure of income inequality now, not wealth. It's not even talking about wealth, income inequality at the top and the bottom end of the scale.
Is
so
income?
It's false, a false claim. I know that paper has been cited, and I can't. The man's name is quite difficult to pronounce. Thweeson is his name. Thewisswen. But the figure table one, I'm looking at it here, evolution of living standard, Ireland, 1987 to 2007, reduction, the Gini coefficient, the only one. Well, there's a slight reduction in Denmark and in France between 1987, but they are compared with 2012 to 13, but they were comparing it with 2007. Why it's quoted today, I don't know. It is completely irrelevant for 2022.
Okay, is income inequality the only inequality we should be worried about? And there are other inequalities which are very serious.
Absolutely. I suppose the most obvious one is wealth, but I've just spoken about, but also access to public services. We have very poor quality services, as you know. We've a totally class-riven and driven health system whereby half or 1-point-something million people are in private healthcare and the rest are not. And of course, the problem with that is you can't get access. Not that the hospitals aren't good, much to what people say. In my experience, public hospitals, they're excellent, but you can't get access to them unless you have sufficient money, unless you can buy private healthcare, you will get jumped the queue. So that's a very obvious thing. We don't have the same, for example, take Austria as a country, which it's compared with in that report. If you're in Austria, you pay like 40 or 50 euro a week for childcare. I mean, anyone in Ireland knows that in most of the cities and towns, you're talking of 800 to 1,000 for one child per month. That's the minimum, and it's more than that. Double that if you have two. So we don't have childcare services. We don't have adequate public services, you know, and in rural areas, there's no public transport, for example. You have to have a car. And that's, I come back to talk about fuel. And then, of course, we should have, you know, carbon reduce it and all the rest of it. But everyone knows the older your car, the higher your carbon tax. So the poorer you are, the more carbon tax you pay on your car. That's a fact, unless you can afford for some miracle to get a new car. So I'm saying that those are other ones, the capacity that people have. You know, childcare is an enormous issue. And of course, there are huge gender inequalities in care services and who gets access to them and how you get access to them for people with disabilities as well. There have been cuts in a lot of services for people with disabilities that have not been reinstated. And as for travellers, I'd leave Breda to speak about that. It's scandalous what has happened in relation to their housing. We are a disgrace by any standards internationally in our failure to actually address the housing, education and healthcare needs of travellers.
One of the inequalities which I think is quite significant is that of longevity. A report published in 2002, Inequality and Mortalities, published by the Institute of Public Health, showed that 5,000 people die each year because of the scale of inequality. And that's hardly ever alluded to at all. And whereas that deals with the state of, say, of 20 years ago, still the CSO in the last several years has confirmed that that almost remains as it is. That about 5,000 people die every year because of inequality, and it isn't remarked upon at all, as far as I noticed.
Well, I think if you're asking me to speak, I think we have normalized it. It's become banal. Actually, somebody did say that to me one day. Oh, we're tired of talking about that. It's banal. Yeah, well, it's banal because it doesn't affect you. And I think that is the problem in what you're saying, Vincent. People don't want to hear. And we have, you know, the capitalist ethic, for want of a better word. There are ethics in capitalism. They're called competition and self-interest and profit-making. And they have become the dominant ethical values of Ireland. And when they have, people don't, you know, hear no evil, see no evil, and you pretend that nothing is happening. So I think that is another problem. And maybe that's where you started out at the very beginning, about the ideological problem, where we try to deny it and pretend that it's not happening. And to me, it's symbolized, I suppose I'm from Ireland originally. We never saw people with electronic gates until the last 20 years. And now I think that's very good metaphor for how privatized and exclusionary Ireland has become. I'm not saying sometimes you may not need them, but often people have them. And you say, who are they excluding? And why are they? And why do they feel fear that they actually feel? And how do they feel to be made safe by having electronic gates? You know, and I think it's a symbol of how we have become as a society. You only look after your own, forget about other people. And that individualized competitiveness, which is not challenged in a public way. Instead of that, we laud people who make money, and we as if they have been given a gift to society. And of course, then everybody else wants to be like that. Everybody wants to be a winner in capitalism because they are the people who are highly respected and gain notoriety. So I think the cultural problem lies underneath the death rate, the suicide rate, for example, among travellers, which are 7 times among men what they are in the general population. Nobody notices. We have lost heart, for want of a better word, and we have lost compassion. And I think when you have self-interest to guide you as your ethic and competition and profiteering, no, you will not see. And you will live in an area and put up your electronic gates and, you know, cut yourself off so you won't see. And I think that's a far wider problem in society. You know, it underpins a lot of this, the ideological closure and the failure. You know, people say, oh, that's left-wing talk. I would like to challenge that dichotomy between left and right. I don't think so that the CSO figures or the Revenue Commissioner figures are ideological. They are there. You can't selectively read them and decide you don't like what's in them. You may not cite them, you may disregard them, but they are there. And so I think it is not a question of left or right. It's a question of face up to the fact that this is the kind of society we've created, and we are creating a more polarized one at the extremes in particular.
Okay, just on these electronic gates, are you talking about gated communities or are you talking just about electronic gates?
I'm well, a bit we could talk about both, but I mean, your electronic gates are ubiquitous. I think some of them are quite funny because you could jump over them and get in. And I don't know, I know maybe the cars aren't even often that expensive that you couldn't jump over them, but I think it's symbolic of something in Ireland where people have them. For what purpose? I don't want to get hung up on this now, the big social media event around it. But
okay, anyway,
yeah, I think.
Okay, can we broaden the discussion then? Louise Bayliss, you've been campaigning on issues to do with single mothers for the last, or single parents for the last, I don't know how many years. Has the situation improved in the last while?
No, the situation has really got bad this year, and I think Kathleen's talking about inequality and inequality of income and inequality of access to services. And this year we found the inequality and access to service was massive. And I'll explain what I mean, and then I'll show you some extreme examples. But last year when the lockdown first came and shops put up signs outside saying children were barred, children were vectors, lone parents couldn't go into shops with their children to do shopping. And there was no consideration for what would happen to a lone parent accessing food they needed to survive. And that barring of lone parents from shops has had a hugely negative impact. There's this feeling that we're now othered, that there was no consideration. There was consideration for people quite rightly with disabilities, quite rightly who were medically vulnerable, quite rightly who couldn't shop because of age. There was inclusive policies for them, and there was exclusion for lone parents. And when I speak up and say, what is a woman supposed to do with a 3 or 4 year old child? She's no choice but to bring the child with her. You can do other things. What other things? Leave them in a car. Well, firstly, that's an assumption that you have a car. A lot of lone parents wouldn't. Secondly, I think Tusla would have something to say if you left a 4 year old in a car while you did your weekly shopping. Then it was, well, can you not get somebody else to mind the child? Well, no, we're in lockdown, we're barred from other households. And it was like, oh, well, you figure it out. And there was just no support and that sense of othering. And while that was hard for parents in Spark, we would hear about the stories and people very upset, humiliated at shops being barred from entrance. I just think the ones we were hearing about were the privileged lone parents, and I use that word lightly because there's not that much privilege in lone parents, but they were slightly better off because they had access to the internet, they had good English skills, they had support in groups like Spark. I just couldn't help, because I work in Focus Ireland now and see so many immigrant women who are in that situation. I just couldn't bear to think of what would have happened to a woman arriving at a shop with poor English and couldn't get into the shop. And it was about the shopping, which was huge, but there was also a lot of the post offices were located in certain supermarkets, and to get their social welfare payment, they were barred into the actual shop to get their post office social welfare payment. And I can't imagine the stress that must have caused some woman who would have gone into the shop to try to collect her money and just be barred at the shop door with a security guard. And that type of inequality happened. And another point that Kathleen said, which was really, I thought, hugely powerful, was when you spoke about the wealthy and how we don't really know how much they have. There's no real examination of their wealth. And I couldn't help but think about when you're poor, the amount of examination of every cent you have, because you have to give in all your documents for your social welfare payment. And it reminded me of this story, this woman who is a lone parent. She was Austrian and she was relying on rent supplement. And the granny of the grandchild wanted the little girl to study piano lessons and the mother couldn't afford it. And the granny said, I'll pay the €25 every week for my grandchild to go to piano. But because they were abroad, she had to put the €25 into the bank account. She was called in about that €25, and that €25 a week that was given for a child's piano lessons was taken off the lone parents' rent supplement. And that examination, that pettiness of examining money being given to a child for piano lessons being taken off, and yet you have people in super wealthy positions and there's no examination or record of what their income is. And that type of inequality too exists. And then at the moment, we've got huge cases of fuel poverty, where we're hearing cases where lone parents have been saying they've been keeping their children in bed till 2 o'clock because it's the time they'd normally come home from school, so that the heating wouldn't be turned on during the day. Now, we've met with the minister and said, look, can we get double fuel allowance just while the schools are closed, just to get people over the tide? And we were told that, well, there was a €3.50 increase in fuel allowance this year. That should sort them out. Now, hold on a minute. There was a €3.50 increase, but that was to do with the carbon tax and to offset the cost of the carbon tax on fuel. To use it now to say that people can suddenly have their heating on an extra 20 hours a week with the schools closed and manage that, it's not happening. And people have choices to make. They keep their children in bed to keep them warm, or they reduce food, or it's down to that level of it. And as I said, so it's this feeling of not being included and not being considered of. And just my very last point, because I don't want to go over my time, the very last point is I talked about access to service, and that is absolutely huge. But just last week we had an incident where a woman who was an ovarian cancer survivor. She was, her stomach has gotten swollen, and she went to her GP. The GP referred her for an emergency scan. She went to the emergency scan and was denied access to the scan because she had to bring her 10-year-old daughter with her. And that woman was turned away from emergency medical care. And I can't imagine any other group in society being turned away for medical care because of their needs not being catered. You know, if there was an elderly person with Alzheimer's, their carer would be allowed to accompany them. If there was a blind person, somebody would be there allowed to help them. If there was somebody who couldn't speak English, an interpreter would go for them. Nobody be turned away because they had special needs. They'd be facilitated. And this feeling that a parent with care can't be facilitated and their medical care needs are ignored because they have a child with them is quite appalling. And that shows the level of inequality that's not just income-based, but it's about inclusion in society as well as the lack of inequality.
That's very powerful. Thank you, Louise. We'll talk about the inner city. Brian, there's I read a piece in the newspaper in the last few months or so, that the problems of the inner city had all been resolved now because of, I think Enda Kenny spent an afternoon in the inner city and everything is fine. Is that true?
Absolutely not the case, Vincent. No, we've seen a huge demand, particularly the thing I suppose that's changed the most for inner city help and homeless since 2013 is, we would have been primarily an outreach service and looking after the people sleeping on the streets. But where we've really had to change over the last couple of years is the level of food poverty across the country. Social Justice Ireland brought out a report that said 680,000 people live in food poverty in this country. 200,000 of those are actually children. So that's the biggest change we found. We found people were coming to us and saying, look, I'm not homeless, I'm not in a homeless accommodation, but can you help me with food? So we're at the point now where we're probably giving out 300 food hampers a month of non-perishable groceries to families and individuals that are either homeless or are living in that food poverty line, and that was the biggest thing that surprised us because we're a rich country. We don't think that we're going to be in a position where people are going to be struggling for food. And I've gone and spoken, about homelessness in schools, and I've talked to teachers that have set up breakfast clubs themselves off their own back, out of their own pocket, to make sure that the kids that come into them in the morning have something to eat. And we should not be in that position when we're in a country of this size, and the inner city in particular has gone through a really turbulent time because, as a lot of people know, we're seeing a lot of big business coming up. We've seen the Docklands development, we've seen the IFSC, we've seen that pop up, and it's kind of brought two Dublins. There's the business side of Dublin, which is very wealthy, and the apartment blocks are huge money, and a lot of the tech companies are around. And then there's the other side of it, which is the people that are from that area, and a lot of those people are struggling. During the beginning of COVID-19, like at one stage, we were distributing 2,000 hot meals a day to people that were, struggling either in homeless accommodation, or we actually started supporting pensioners that were cocooning because of COVID-19. So the food poverty thing is a massive problem. And, not only do we see it, but the Muslim Sisters of Era, Cork Penny Dinners, Brother Kevin's Capuchin Day Centre, the Mendicity Institute. There's a lot of people out there trying to support people with food. And I think that's a very scary place to be. I know another side to it is something that we've made an awful habit of privatising problems in this country, and we've done it with homelessness and housing. We've privatised it completely. So a lot of the state-funded accommodation units, the hostels and so on, are now being run by private operators who might do it at a better price, but they're not offering the on-site support. They're not offering the mental health, the addiction, all the things that people will need to come out the other end of homelessness. And we've kind of moved that into the housing market. As everyone knows, we hear all of the terms, the vulture funds, the cuckoo funds, the REITs. They're all coming in to making a huge amount of money off the housing crisis in this country. And again, it's a public societal problem, but that we seem to have outsourced to private investors. And as long as we continue to do that, we'll never get a solution to homelessness. We'll never get a solution to inequality. And like one thing that really kind of struck me, an article that was in the Sunday Business Post 2 weeks ago, the average cost of a 2-bedroom apartment in Dublin City is €455,000 and would take a combined wage of €117,000 just to be able to get a mortgage on it. And I think if the last 12 months has shown us anything, the frontline heroes, the people in the hospitals, the nurses, the student nurses, all of those people have come to the forefront as being the people that were most important to this country in the last 12 months. A lot of those nurses that start as a staff nurse get an average of about €30,000 a year. So if someone says, a house or an apartment is affordable, let's relate it to how many nurses' wages would it take to actually get a mortgage on that. If it takes 3 or 4 nurses just to get a mortgage on 1 2-bedroom apartment, then it's not affordable. And we need to really look at ourselves as a society and say, how can we be better? Because, you know, there's a lot of people that don't make €50,000, that don't make €40,000. Everyone should be entitled to be able to get on the property ladder. And I think as long as people keep pouring money into the rental market, it's impossible for anybody to be able to save and actually get on the ladder. Like I grew up in the 80s, and, you know, I remember a time where both parents, one could be a nurse, one could be a postman, and they had their family home and they had their little car and they had their holidays in Wexford and they survived. But we're getting further and further and further away from that in 2021. It actually scares me because there's so many people slipping between the cracks. Like, for example, the social housing threshold. There's a lot of people that are just above that threshold that aren't entitled to social housing, and that really struggle to pay their rent and pay their bills. And we've had parents that have actually slept in our office with our CEO in one case in particular, and it's one I refer back to. A lot of people like to generalize or, you know, say there's chaotic lifestyles and there's reasons that people become homeless. So many people have become homeless in the last 5 years from the private rental market for the very first time. They've never been homeless before. We saw an increase from 2015 to 2019 of over 400% in the number of homeless children across the state. Now, if those children were all sleeping on the streets, we'd have all marched on the Dáil a long time ago, but because they're in bed and breakfast, they're in family hubs, they're in hotels, it's kind of forgotten about. And I would encourage anybody that, you know, has the time to read the Ombudsman for Children report that came out a couple of years ago called No Place Like Home. And they speak to the children from the age of 4 up to 18 on what life is like in these emergency accommodation units. And the mental health strain, you're talking about a 7-year-old child who doesn't want to wake up some mornings because of the environment that they're in. And the scariest part of that is to put a family of 4 through emergency accommodation for a year is about €69,000. So, you know, I'm going to coin a phrase that Tony Groves from the Tortoise Shack uses. You know, we're a not-for-profit charity, but there's people out there that are misery-for-profit companies, and they're in our country, and they're making a lot of money on the back of inequality and on the back of people's pain. And, you know, we can't allow that to continue. I want to just go back on something Kathleen said, and you were right, Kathleen, when you said that it's not about left and right. Like, for me, it's about right and wrong. And there's something very wrong in our country when we have a population of 5 million people and 200,000 children are wondering where the next meal is going to come from, or will they have enough food to get them through the week. And I think we all need to have a strong look at ourselves in that regard.
Okay, thank you very much. Breed, I don't see you on the screen, but can you tell us about the situation in the traveller community?
Yeah, well, I suppose, look, not to echo what Louise and Brian were saying, but it's very similar. Look, travellers have been facing inequalities for all of their lives, basically. We have state policies in place that keep travellers facing inequalities. We have state policies that has decimated our culture over the years. They have not only but made it illegal for us to practice our nomadic tradition, but they've also failed in their provisions of providing traveller-specific accommodation. You know, we have families, probably 3 and 4 families per bay living on sites here in Cork City. We have severe mass overcrowding, and they're the lucky ones. You know, they actually have a hard stand to put their caravan on. We have over 500 traveller families here in the city, and we only have 4 traveller halting sites. We still have 2 unofficial sites where children have to use the library in the wintertime to do their homework. And I suppose facing that level of inequality, I mean, if you look at traveller stats, and I know Kathleen mentioned it earlier about our suicide rate being 7.5 times higher, we believe it's more. We don't have an ethnic identifier. We also, I suppose, and to quote Owen de Bardoon, like 50% of travellers don't make it past the age of 38. So for that 50%, middle age is 19, you know, so that's the level of inequalities travellers are facing right across the spectrum and through the education system. And we have travelling children coming out of school 11 and 12 years old without being able to read or write, because we feel there has been no investment in that child and there's no expectation on the traveller child to complete their education. Also, they have no, I suppose they have nothing to aim for, in the sense that to go through the education system, they will then have to deny their ethnic status to get a job, you know. So across the board in our health system, we have the same stats now that we did in the very early 80s, when the first health study was done on travellers, and we are exactly in the exact same place. Travellers are still dying 15 years younger. Traveller men are dying 15 years younger, and traveller women 12 years. Our infant mortality rate is 3.5 times the national average. And if you think about that, we're 1%, less than 1% of the population. And it's not rocket science. It's not even a matter of funding. Government have been allocating funding towards accommodation for years. It's just gone unspent. You know, we have no political goodwill to provide better traveller specific accommodation. And as we know from the social determinants of health, if your accommodation is poor, that's going to affect every other aspect of your lifestyle. So from the get-go, from the minute a traveller child is born, they're facing inequalities, and they'll go right through their life facing inequalities right across the board. And what we are left with now is, and I know that the whole country is in a crisis, an accommodation crisis, and we're also in the middle of a pandemic. But prior to either of those situations, travellers have been facing these types of inequalities where it comes to accommodation. Very poor accommodation that has been provided has been left run into the ground because of the severe overcrowding. We had a Trespass Act brought in 2002 that completely decimated our culture. And we believe that all of that slowly pulling away of our culture has had a detrimental effect on travellers' mental health. Mental health is rampant in our community right now. Drug and alcohol addiction is rampant within our community right now. We have a community that doesn't use services the way the general population do, because they're not designed to deal with traveller culture or traveller issues. So we're left in limbo with young traveller boys and girls that's coming out of school at a very early age. No follow-ups, nobody asking any questions why these children are not in school. Nobody wondering, well, when are they coming back, or if they're coming back. So we don't have the same level of care that the average person has. We don't have the same protection from the law that the average person has. So what we're left basically with now is a community that's been decimated in the middle of a pandemic, and where we have mental health rampant. Actually, there's an epidemic now of mental health within our community. So,
of course, one of the problems that you have is the stigma associated with being travellers.
absolutely.
And that's why the accommodation budgets are not exhausted every year, not spent every year, because of the opposition of local groups to traveller accommodation.
Yeah, well, look, we have some good policies in place, but we have no sanctions if they don't happen. And that's the biggest issue for us. It's not that, like I said earlier, that we don't have to reinvent the wheel. We have some good policies. We have some brilliant recommendations by community organizations like ourselves, but we have no sanctions when things don't happen. Like the local authorities doing a yearly count, doing a 5-year accommodation plan to provide traveller specific accommodation. That doesn't happen. We're in our 5th 5-year plan, and we still have had no addition to traveller accommodation here. And I'm just talking about Cork City, but it's exactly the same across the country. We have had no addition to traveller accommodation in over 30 years. So if local authorities are meant to do a yearly count of travellers in their area, where do they think those families have gone if they have made it illegal for them to be nomadic and they didn't provide any traveller specific accommodation and they're not being housed? There's major difficulties with travellers acquiring accommodation through private rental because landlords won't rent to travellers. So where do they think, or do they even care where these families are, or where they're living, or how they're surviving?
Okay, Ber, you're the last of the participants, I think, to get to speak.
Last but not least, Vincent.
I've forgotten the organisation that you represent.
That's okay. I'll forgive you, Vincent, because you're a national treasure. I'm actually not representing any organisation. I'm representing a group of deadly volunteers who every year we decide to come together at Christmas and we do up Christmas food hampers. So it's the Basket Brigade is the group. Brendan Ogle has very kindly been calling it Grogan's Basket Brigade, but I'm just the one with the geeky coloured Excel spreadsheet for organising everything, and it's the group of volunteers and people who get involved every year that makes it happen. And we link in with different charities to find out families and people that might need a bit of a hand at Christmas. So they get a big Christmas food hamper that might be worth you. So we'll have like the Christmas staples, but then have the non-perishables as well that will last them longer. You know, to have in their cupboards. But it's 13 years, 14 years, I think. I volunteered on it the first year and was so moved by it. And this was during the Celtic Tiger, during the boom years. I was so moved by the event that the next year I said to my mum, you know, will we do this? And we coordinated and rounded up a group of brilliant people, most of whom who, you know, come back every Christmas to say, like, are we doing it this year? And obviously over the years we've added in our Christmas jumpers, and you know, they have to listen to cheesy Christmas songs as we're bopping around and everything as well. But it's a touch of reality to say we're all going about our daily lives, and it's like Kathleen was talking about, and I actually think your analogy of the electronic gates was really powerful, because it's only those of us who think about the greater good and who think outside of ourselves that get up off our arses and do something. And I'm listening to all of you here today, and it's like, it's so enraging. It's so enraging. Like, we need Kathleen and Vincent to lead the revolution now, you know, to get rid of the capitalist society.
Kathleen for that, yeah.
We need you back, Vincent. But it's also so inspirational to hear Breda, Brian, Louise, and to hear people making a difference on the ground. Of course, we shouldn't have to be doing it. You know, we should have an egalitarian society. We should have equality built into everything. But while we still have, you know, the liberal politics of Fine Gael, Fine Fáil, who created the housing crisis from their policies, while we still have that, you know, those of us are on the ground doing our best and talking to each other and learning from each other. And I think particularly Breda and minority voices now are becoming more and more vocal, and from having people like Kathleen in our universities over the years is giving people a voice and creating a strength. And we will get there eventually, but we are still needed today more than ever, as much as we were in the recession. The Christmas is a really expensive time for a lot of people, and a lot of the families that we deliver to are single parent families as well. And I actually remember I was thinking about a lot of this today, thinking about the report. I remember one year delivering one of the hampers myself to a woman who was sick. She was really, really sick with a flu a couple of Christmases ago. She'd no family here. And she was like, she was a late addition to our list, because I like to under promise and then over deliver on the hampers, because I'd hate to commit to more hampers than we were able to actually come up with on the day. So it might have been Christmas Eve or Christmas Eve, and calling out to her house, and she's crying with gratitude because she was so sick she couldn't make it to the supermarket. She thought she was going to have no food for Christmas. She had no neighbours, no community to call on to say. Now, she did have neighbours, but it was that kind of thing of everyone living in their silos. And I was actually talking to Mom about this the other day when we were talking about this evening on the Basket Brigade. And, you know, back in the day, Granny and Grandad, you know, wouldn't have had a lot, but whatever you had was shared with the people around you. And that's something that I see from people who volunteer with the Basket Brigade every year, that I see with Inner City Helping Homeless, Spark, One Family, the Deaf Village, so many organisations that do try and create communities and try and create awareness, but the need is not gone away. It's just that the rich are getting richer, and they're also getting louder. You know, their voices are heard more in the media. Like the fact that this Hungry Bellies are not equal to full bellies report had to be done at all, because Pat Leahy was misquoting research, and then Jerry Buttimer was bringing it up in the Shannon and saying, they're, you know, oh, we're becoming more equal. You know, it's unfair, because the people that we're trying to volunteer with, the people that we are friends with, the people that we are in communities with, don't have those voices. They're not listened to as much, except for when like Unite and Tony Groves and the Tortoise Shack and people give voices to the normal. We're the 99% or whatever it is. There's more of us than there is of them. They just get to say more than we do.
Just a question I could put to anybody who wants to respond to it. That it seems to me that the priorities given on the vaccines miss out on people who live in overcrowded conditions. And I would have thought that they would be pretty close, pretty high up the priority list, certainly ahead of people like me who's in the 70s. And it doesn't even get discussed that people living in crowded conditions, which many people do because of the housing situation. And they're more vulnerable, they're more likely to get COVID than the rest of us. And it doesn't get a mention. I don't know if anybody wishes to comment on that.
Yeah, I suppose just to, if it's okay if I'll come there. We have been mentioning that for some time. Like Travellers at 50 is pretty much like 70, 75-year-olds within the settled community. You know, the majority of our over 50-year-olds are in chronic ill health. You know, and they're probably going to be dead by the time they're 60. So we have been talking to NEFID as well about looking at the possibility of having some of our 50-year-olds probably on the list for vaccines sooner rather than later. We have been hit very hard by COVID, and when we are hit, it turns out to be quite a big outbreak. We had a very large outbreak here in the city in one of the sites very recently, which led to a 60-year-old man dying, you know, and we have been looking for I suppose preventative measures to be put on that site for the last 9 months, and now there was a great response once the outbreak happened, but in the lines of preventative measures, it wasn't as good as what it could have been. So yeah, we are talking to NEFID about that, and we're very concerned actually because of the level of ill health that's in my community, and particularly 50 to 60-year-olds, because we don't have many over 70-year-olds at all. We've very little. We've about 2, maybe 3 people in Cork City over 65.
Good. Kathleen,
I was just going to say, I think direct provision as well, Breda, I mean, yeah. Direct provision are grossly overcrowded. Many living not just in the one room, but also families who are not related living in the one room. Again, they weren't prioritised, like you were saying with Travellers. Because it goes back to what you were saying, Bar, they don't have a voice. And I think if we are going to have a democracy where it's going to be governed by the people who have most money to buy media coverage and the most money to actually influence, you know, by buying advertising in print media, which will determine what is or is not said in those media or in televisual media, then we won't have a democracy. We'll have a dictatorship of those who have the power to influence public opinion. So that's all. I think that's very serious in relation to COVID, because multiple families now with the housing crisis are living in the one house. You have 3 generations of people, not in direct provision. You have the Travellers, you have people in 2 or 3 families because they can't get housing or they can't afford it if they could get it. So yeah, I just wanted to answer you on that. Sorry.
Yeah, Vincent, just one other thing on that, further to what Kathleen said, like we're still seeing situations in hostels where there's 3 or 4 people, total strangers sharing the one room, and in some cases without any windows, without any proper ventilation. And you know, Orla Hegarty is one that has been beating the drum since last summer about COVID and the need for ventilation and the need for opening windows, and how much that can have a big impact on the spread of COVID. So, you know, it's definitely a concern. And, you know, one thing we beat the drum of consistently in ICHH is when we hear the monthly homeless figures that are released by the Department of Housing, they don't include anyone that's sleeping on the streets. They don't include anyone in direct provision. They don't include any families that are in women's aid shelters. And they certainly don't include anyone couch surfing or living in overcrowded homes. And, you know, we see other countries in Europe that include those figures in their homeless figures to be very transparent about it. But it's not something that we do here, but it obviously is a huge issue. And I think anyone that has canvassed on a local election or you know, for a general election over the last couple of years would know from calling on doors just how many people are living under the one roof in a lot of places.
All right. Anybody else want to get in?
Yeah, can I jump in there?
Yes, go ahead, yeah.
I think since last year, it'd be very hard not to notice that areas with the highest prevalence of COVID-19 are in more disadvantaged areas or socioeconomically deprived areas. I'm in Finglas, and every time I look and see Ballymun Finglas really high on the list, you're just thinking, oh my God, but it is generations of families that are living together in different areas around Dublin and areas around Ireland. It's people who have to get the buses in and out of work, who have to go and have the frontline jobs. You know, they don't have a nice little office, fancy office at home with great broadband, and you know, there is a drive for iPads and for computer for children in direct provision and in homelessness, because suddenly they had to do schooling online. That's assuming that everyone has access to a tablet. So I think that's something that hasn't been spoken about enough with COVID-19. And sure, you know, they finally realised that social welfare rates for the people on disability and that, you know, 200 quid, 250 quid a week isn't enough to actually live on, when they had people from higher wages, you know, who tragically lost their jobs during this. But, you know, we're getting 350 quid or more a week.
Okay. How can people be mobilized? I don't mean the people who are taking part in this discussion, but people generally be mobilized. First of all, to be made aware of the scale of inequalities that we have, and then mobilized to do something about it and to vote accordingly. And anybody want to comment on that?
Well, I'll just say something. I think the message needs to go out every day, all day. I mean, if I can speak about, I mean, the reverse of how this is done. We saw the Tea Party in America. I mean, there's some excellent analysis done of how they gain control. I'm not saying we follow their footpath now, but I think one of the things that's very important is, you think you've said, and you said this to me once, Vincent, and I've never forgotten it, the great whitewash of the media. You think you've made a point someday in the media and you think, that's it now, I've done my bit and everybody knows. It doesn't work like that. And I think I think that we need to get the message out there all the time and remind everybody every day. And it's the responsibility of the public media. And if, you know, to make those issues public issues, because
okay, but how do those of us who are now not part of the public media, how do we manage to persuade the public media to do this? How do we persuade people to vote differently than they do and to prioritize the issue of equality?
Can I just say something there, Vincent?
Yeah, Louise.
I think the only way I can see of mobilising people is to use the human narratives. I mean, people respond better when they see the child eating its dinner on the street outside the GPO, so they respond to those things. But there's a huge balance there, because people are entitled to their dignity. And sometimes in Spark, we're often approached by journalists looking for stories and examples, and they want to hear these really sad stories, and parents want to share them, but they want to keep their dignity and not share them publicly, and not have their child photographed, and not have their child stigmatized by going to school, but 9 times out of 10, the journalist will say, unless the person will put their name and face to it, we can't use the story. So there's a real balance line where you want people's stories to get out there so that if people can hear the reality of people living their lives behind closed doors, but at the same time, respecting the human dignity and the human's family and the right to privacy. So it is a borderline of how to get those stories out while protecting them. And that's the dilemma, I think. I think most people, maybe I'm very naive, but I think most people want to do the right thing by people if they hear the stories. I mean, it's as Kathleen said, get locked behind your gate. You mightn't see what's going on and it might be easy for you to sleep at night time. But if you actually hear that there are children going to bed hungry, if you actually see the reality that people are facing, that people are sitting there watering their milk to get 3 days out of the litre of milk. If you know that's what's going on, it would be harder to argue about a 1% tax. And I think it's really important. I really do appreciate Unite the Union doing this tonight, because I think it's so important that we mobilise now. I think the last time the recession hit, there was a bit of shell shock, and there was, the most vulnerable groups were attacked, and then you're always on the defense. I think it's really preemptive of us to prepare and make sure the vulnerable in society are protected before this next, because people will pay for this, and it's who pays is what we need to mobilize to protect.
Yeah, the one thing I think we can all say is that when we had the recession previously, it created a lot of millionaires and billionaires, but it increased that inequality gap across the country. And, I think we can't let COVID be the reason that happens again, because it's already big enough. We can't allow that gap to get any bigger. As you said, Louise, I know it's something we have a dilemma with in ICHH every day is, a lot of times media will want to speak to a family or a child that's been affected by homelessness, but you don't like putting them out there either, because there's a lot of begrudgers out there. There's a lot of people that will throw insults, particularly on social media behind fake accounts. So it is a balancing act, but I think we do need, I think a lot of people are moving away from the fact that we used to be just about RTE and TV3 and The Independent and The Times. I think we're starting to come out the other end of that. Podcasts are becoming bigger, other newspapers, the likes of the Tortoise Shack, The Currency, these people are doing phenomenal work. So I think we just need to make sure that as many people are hearing these stories as possible.
Okay.
Yeah, so first of all, I reckon Brian is getting a few bob from Tony Groves and the Tortoise Shack, because that's twice he mentioned him this evening. I'm going to have to get on to Tony on Twitter. I think we need to do a mass registration of voters. If everyone turned out to vote, that we know that the turnout in areas that are most affected by austerity and that are most forgotten about in government policy is low, because people are disenfranchised.
And who would they vote for?
Who would they vote for? Well, there's some good lefties out there, and
Sinn Féin.
They might vote Sinn Féin, yeah, and sure, let's give Sinn Féin a chance. They might vote
same as.
Yeah, I think we've only ever had Fianna Fáil, Fine Gael, and the Greens, or some mishmash of independents supporting them. We haven't had a left-led government. We haven't. Apparently Fianna Fáil, are the government of the party of affordable housing, and like, sure, that's the most laughable thing you'd ever hear. But if community activists, grassroots activists get involved in now obviously I know with COVID you can't be out on the ground, but it was a project that I wanted to run out here in Finglas. I've been out in the village and registering people as they're turning 18 and encouraging them to use their vote. There's some great people who want to get into politics, who run as independents or smaller parties, who don't have the big party machine behind them and don't have the media bigging them up on every other occasion. There are some really great people out there. And the other thing as well is to give another shout out to Unite and the branch of Unite in the Community. I'm a member of Unite in the Community. If in work, I'm a member of SIP2, but for activism stuff and organising, I'm a member of Unite in the Community. And this work that Rona McCord and Brendan Ogle do on the ground is absolutely amazing. So they've supported Basket Brigade financially a couple of years, but they also just things like there's other things happening in the community, and they can say, well, we can print some leaflets for you. You know, they're involved politically. It's not just about the trades union work. It's everything else in the communities. And I think when people realize that we have more power, like the rich classes and the landlord classes are always going to get out and vote, and they're always going to get out and vote for the people who are doing the best for them. So let's give the other parties a chance. Hashtag vote left, transfer left.
Okay.
I think that's very interesting, though, because if you look at what happened in Georgia, America, and the election, you know, Stacey Abrams did exactly what you're saying. She got, but I do think you're not going to be able to control who people vote for. They will vote. But it is true. And I remember many years ago, one of the older politicians saying to me, who was in the Workers' Party, I remember him saying to me, I will canvass in this area that only 10% of the people here will vote. And I think that's a very serious issue. If people don't vote, you can't be represented, but it does require a campaign. And I think you're absolutely right, Bear. I think it's a very good idea. And I think as well, we want idealism. And I think you're very cynical, and Vincent is around, and I'm around a long time. And you feel, oh my God, they'll all be the same when they get in again. But I think we should call on people, what you said, Brian, earlier. You know, there is a difference between right and wrong. People don't use that language anymore. Mm-hmm. There is a difference between what's immoral and what's downright immoral. What's happening to travellers in this country is a travesty. Direct provision, housing, loads of other issues. I didn't go into education. Like there's nothing, and that I want to say, what of all the children in the poor areas of the city who have no tablets, nothing, and who have lost out on their education during the pandemic? Who's going to fund them? Anyway, but I think your idea is good, but we do need idealism in politics. I know that may seem like an oxymoron and a contradiction terms to some people, but you know, people are looking for ideals. Young people are looking for idealists, and they want the politicians, whoever gets elected, to follow what they said they were going to do, not to rant on and then to go into power and do the direct opposite of what they said. That makes people cynical, and that's what gives the really extreme people of, you know, that followed Trump their power. It did, because people become cynical. They say, we're going to do anything anyway.
And we've seen where people power works.
Integrity is very important, and we need a serious renewal of that in this country in politics.
We've seen, I think, a really good example of people power in the past 6 months was the Mother and Baby Homes campaign. You know, was it over 120,000 people signing the petition, and the Oireachtas server actually crashed because so many people were engaged and were emailing their TDs. So there is that that momentum behind some campaigns. It's just trying to figure out how, and it's not, you know, I know, as Louise was saying, the media are often looking for kind of, you know, the sob story, so to speak. But I think as well, it's about empowering the single parents and the people in direct provision, or, you know, people who can register to vote, who are allowed to vote. Let's get everyone registered and actually voting.
Also, I think we're based on what you were saying there, but like something I think that needs to be done, particularly if we want a change in who's been in power in government for the last 100 years. I think the likes of all of us on this call have to come up with documents that aren't saying to anybody to vote for Sinn Féin, to vote for people before profit, but highlighting exactly what's going on in this country under Fine Gael and Fianna Fáil, and why voting for them is just perpetuating the problem and in fact increasing it further. And I think another side to that is, you mentioned the vote left, transfer left. I think we need to be kind of more country inclusive. I mean, we're Dublin, a lot goes on in Dublin, a lot of the big stories are Dublin, we're based in Dublin. But I think every county needs to understand exactly what's going on, all the decisions that are being made and how much of an impact they can still have all around the country. And, you know, I know from certain parts of the country, when it comes to a voting process, which TD has done something for the local area is still a factor in who they vote for, irrespective of the party politics or the policies behind that. So, you know, I think we definitely need to do better on highlighting what's been done wrong by the current government and the previous couple of governments, and why the inequality gap and the housing crisis and the health crisis have been perpetuated by them. And I think we need to get better at communicating that right across the country.
Okay, Brendan, have you gone? Are you asleep, or you've left, gone out for a few pints or whatever? But I think that we've more or less exhausted the discussion, and maybe ourselves. Brendan is.
I don't think he's coming. I think he was going offline and was leaving all the power to yourself.
Well, anyway, I think that we've exhausted the issues that we wanted to talk about, but I found this really interesting, and I feel I need to be re-educated again, and this is the first installment on that. And thank you everyone for taking part.
Thank you very much.
Thanks, everyone.
Thanks so much.
Good night.
Thank you.
Thanks, Vincent.
Thank you.
Bye.
Thanks, everyone. Bye.
Thank you. Bye. Bye.
Bye.